1st, 1,302 seniors, elders, and people with disabilities will lose the care that helps them stay alive. And 14,000 will lose their health care simply because of where they were born. This is even more frustrating and devastating because we believed that the supplemental budget that we passed this year, this session, included enough funding to cover care for nearly 1,200 immigrants, with the intent and high probability of covering everyone. Our intent as compassionate lawmakers was to prevent everyone at risk of losing their long-term care from this horrific situation. And as practical lawmakers, we know that providing coverage is also the fiscally responsible thing to do. But due to a recent draconian decision by the Center for Medicare and Medicaid that accelerated the eligibility of cuts, the funding now covers only 173 people, leaving 1,302 without long-term care or health care, not to mention the 14,000 people who would lose Apple Health in this state. What happened here is a perfect storm of cruelty through implementation of H.R. 1. And let's be very clear, this is a cruel policy. Instead of CMS allowing rolling eligibility changes, that is, as people's annual Medicaid eligibility comes up, determining ineligibility at that point, CMS has directed states to pull the plug on everyone all at once on September 30th. This means the full cost to the state to prevent cuts in immediate versus growing slowly over the first year of implementation. What's more is that a long-standing agreement between Washington and the federal government was also tossed out the window, eliminating eligibility for SSI recipients despite a clear contradiction in federal law that should mean these folks keep their Medicaid coverage. This is not a federal government that believes in partnership with the states or about taking care of people. DSHS and HCA are struggling to make the most with the $19 million appropriated, but they estimate an additional $60 million would be needed to provide health care and long-term care to this incredibly vulnerable and sick population through the end of fiscal year 2027. Right now, what we know is that the 173 people who will be covered by state dollars are all of the people with exceptional needs. Long-term care is how people with disabilities